Hello everyone, today I'm back with different topic with the same energy. So to our discussion point that is selected for today it is brucellosis. It is one of the most common zoonotic bacterial infection usually encountered in tropical regions. So it is brucellosis. So brucellosis, it is a gram-negative bacteria. It is a gram-negative bacteria. It is anaerobic and it is non-spore forming. It is an forming anaerobic bacteria, and this is usually a threat for what? It is a threat for what? Biowarfare. I will tell you later on why it is a threat for biowarfare, but it has a potential biowarfare ability. So, and the other most important and essential one is it is a zoonotic one. A zoonotic one means it is transmitted from the animals to the peoples, and usually the peoples acquire these infections from animals like cattle, sheep, and goat are the most common microorganisms that are mentioned. The other one is, let us see some of the microbiology here. Just briefly, when you come to the microbiology, there are different type of species that can be mentioned as a subspecies for brucellosis, but the most common ones and clinically important are: the first one is Brucellosis metensis, and usually this is found in sheep, in camel, and in goats. The other one is Brucellosis abortus. Usually people acquire this infection from the cattle. A, B, C. The other one is Brucellosis suis, and the last one is Brucellosis canis. And this one is usually acquired from dogs, and this is canine animals. So the survival mode of brucellosis, what it to do is it reproduce inside the macrophage. It reproduce inside the macrophage. So what is the epidemiology? What is the epidemiology of this brucellosis? Normally, brucellosis usually distributed or presented in the worldwide. It presented in the worldwide, and its mode of transmission is, as I mentioned before, it is zoonotic. But human acquire this microorganism from different ways. The first one is with direct contact with the microorganisms. The other one is inhalational, and the last one is ingestion. And for inhalation, the most commonly exposed are lab workers. Lab workers are the one who is at risk for developing of inhalational brucellosis. So pathogenesis, how brucellosis cause microorganism for a patient. So what is the pathogenesis of brucellosis? When it comes to the pathogenesis, as I mentioned before, it reproduces inside the macrophage, and it is one of the essential evasion mechanisms from the immunity. Initially, the pathogenesis, there is intracellular pathogen will present. Intracellular pathogen will present, and these intracellular pathogens like macrophages, they evade the immunity systems. And these macrophages took these microorganisms into the reticuloendothelial system. These reticuloendothelial systems like liver, spleen, and lymphadenopathy will presented in this patient. That is why in the clinical presentation, this patient also could have this kind of organomegaly and the splenomegaly. Then finally, this inside the reticuloendothelial systems, the microorganisms produced non-caseating granuloma formation. There will be non-caseating granuloma formation in the reticuloendothelial systems, in the reticuloendothelial systems. And once it infected, it can cause two things. The first one is there is a focal separation. And there is a chronic inflammation. These are the two things that happen after the brucellosis infections. So what are the clinical manifestation? Normally, incubation period for brucellosis, it took about 2 up to 6 weeks. Compared to other microorganisms infection, as we have discussed before, this one is a little bit a protracted one. It has a chronic and slow progress. So initially, it could present as acute febrile illness or AFI, and if it is missed as an AFI, there may be develop what acute monoarthritis. Acute monoarthritis usually in the children's are hip and knee joints. Hip and knee joints are the most common ones. Then in the third one is there is a chronic fever and lower back pain. There is a chronic fever and lower back pain will be the most common nature. And from the lower back pain is the vertebra, especially the lumbar regions of the vertebra, are the most commonly infected places nature. So how do you diagnose these microorganisms? The most sensitive way of diagnosis of these specialties, it is culture followed by PCR followed by clinical coordination will be the management. So in the management, in the early phases, IgM might be elevated, but later on IgG becomes the most prominent ones according to this. And another investigation is it is PCR and FNAC. For the patient with such kind of lymphadenopathy swellings, FNAC is usually recommended, and for the case of brucellosis, we will have non-causating granulomatous. Non-causating granulomatous TB formation will be natural. So the next one we are going to discuss about TB versus brucellosis in the case of spinal. So let's compare and contrast what is the real difference between brucellosis and tuberculosis, especially in the case of spinal case, because they are mostly have some common clinical features, but their differences usually with the spinal studies like MRI or CT scan. So what is the imaging will look like in the case of brucellosis or in the case of spinal MRI. So this is the MRI of let me open it again. These are some imagings of spinal MRI and brucellosis. So the first difference or the classic difference is it is a place where you see about the site of involvement. In the site of involvement, as you see for the brucellosis, usually the lumbar region is the most common area to be involved, but in the case of tuberculosis, thoracic regions are the most common site for involvement. In the case of vertebrae, it is contagious. It is contagious forms, or it could be multiple forms. For these cases, it is usually involving only these regions. Only these regions. Even you see that another images, some form of the brucellosis effect you have also seen on the lower anterior upper border of the lower vertebrae of the lumbar region. So this is also another good examples that the vertebrae can be contagious or multiple in the case of brucellosis. The same for tuberculosis. Discitis, in the case of discitis or inflammation of the intervertebral disc like this, and this, they are the intervertebral discs. In the case of brucellosis, they are usually intact. Have you seen this? They are intact, and usually they inflamed or they cause discitis in the late times. But in the case of tuberculosis, discitis is usually in the early phases. It can be observed. And the other one is the body. When you see about the body in the brucellosis, it is intact. Yeah, it is intact bodies. You see there is no deformities on the bodies. You will see on the body of the vertebrae. But in the case of tuberculosis, the morphology is usually lost early. But in the case of brucellosis, the morphology is lost late. In the canal compression for tuberculosis, it is rare, and for brucellosis, it is rare. For tuberculosis, it is common. Canal compression is common. Epiphyseal or the inflammation or osteomyelitis of the vertebrae, it is called epiphyseal. Epiphyseal is usually involving for the brucellosis. It is anterolateral areas. All the regions, have you seen that? They are anterolateral regions. This is the anterior part and this is the posterior part. This is the posterior, it is relatively clean, but the anterior one is usually inflamed. There is osteomyelitis here. It is called epiphyseal. So in the case of brucellosis, the anterolateral region is the most common area to be involved. It is sometimes called a POMS sign, but in the case of tuberculosis, the general or the upper and lower disc regions are usually involve like this. In the case of spinal region, we will discuss it in the following slides. So finally, let me summarize. How do you manage this patient, or how do you treat the patients? So we have usually used a combined type of region treatment for the treatment of brucellosis, because there is an emerging of developments. Currently, brucellosis, they are resistance for what? They are resistance for ampicillin, they are resistance for ciprofloxacin, and they are resistance for fluoroquine. These are the most resistant microorganisms for shigellosis. So the treatment options are usually we are using combined treatment management. It is called combined type of management nature. Usually we are grouping or creating a joint between different microorganisms. For example, doxycyclines with 6 weeks of treatment is POBD for mild and to moderate. For mild to moderate, doxycycline 100 milligram POBD. And another important microorganisms is streptomycin. Streptomycin from 0.17 to 1 gram over 2 up to 3 weeks will be the clinical manifestation. Streptomycin. If streptomycin is negative for this patient, the likelihood of developing this animal symptom is before. And another option is doxycycline with rifampicin. Doxycycline with rifampicin. I will read this patient to your health provider የምናደርግበት ቦታ ጋር ቼክ ማድረግ አለበት። we have to check ማለት ነው። So for what duration do we have to provide this microorganism? So for the first one is doxycycline with streptomycin. At least for the doxy we need to treat for about 6 weeks, and for the streptomycin we have to treat about 2 up to 3 weeks ናቸው። It is the medication is provided, I mean, if this is the best medication currently, doxycycline with streptomycin is the best medication. We are treating also the relapse nature, but if these medications are not available, we can treat them with also doxycycline with ampicillin. Doxycycline with ampicillin we can treat nature, and the mode of treatment will continue for about 6 weeks in order to avoid any resistance to the hectic microorganisms environment. The hectic microorganisms environment, it has high viral loads. The other one is for special population. In terms of treatment, special population, children. For children less than 8 years, and for the less than 8 years, we are using more about rifampicin and cotrimoxazole. Rifampicin plus cotrimoxazole. And for the brucellosis, it is about 3 up to 6 months of age of, and we can treat them with also ceftriaxone. And the last one is for the pregnant mothers. For the pregnant mothers, it is better to refer her to the specialty centers. And finally, the progress. When we share about the progress of this streptococcus brucellosis, if it left untreated, and if it is with a proper treatment, mortality it is 1 up to 2% from the patient. And if the child is the other most important thing is that if the child is 9 years, we need to use rifampicin with cotrimoxazole. You have to discontinue ciprofloxacin and other alcohol reagents. So this is all about brucellosis.